Hi, I'm Scott Smilen, a urogynecologist, and I'm professor of OBGYN and department chair in the Hackensack Meridian School of Medicine. I currently serve as the AUGS Publications Committee chair, and today I'm conducting this interview by virtue of having been a liaison to the writing group for an AUGS-SUNA Joint Clinical Consensus Statement entitled Vaginal Pessary Use and Management for Pelvic Organ Prolapse, which was published in January 2023 concurrently in both urogynecology and in urologic nursing. And it's my pleasure to be joined today by Dr. Amy Hull, one of the members of the writing group for this document, as well as Dr. Jeffrey Clemmons, who is the writing group chair. And I'd love it if you each can please introduce yourselves. Dr. Hull first.
Hi, thank you everybody for having me. Thank you for the opportunity. I'm a nurse practitioner here at Vanderbilt Medical Center in Nashville, and I've been doing pessary care for a number of years here in our Urogyn division. And so happy to be a part of this, and I'll turn it right on over to Jeff.
Hi, my name is Jeff Clemmons. I've been practicing, I guess I started fellowship in '99, so that's over 20 years now. That's a long time. For those of you who've met me before, I was in the military for many years, and I work in Tacoma, Washington at Multicare Health System now. And anyway, this is a fantastic writing group to be a part of, and it was a lot of fun and interesting challenges that we ran into, and that's what we're going to talk about today.
All right, thank you so much. You'll note that I did not give my time frame of training because it's too far back. But why don't we start with Dr. Hull? And why don't you this was a unique document. Why don't you tell us how this joint writing group was formed?
Yeah. So it actually came about, we were just kind of talking one day about really the lack of really good guidance available to us on pessary, whether it's pessary fittings and also pessary management. And so, as with everything, groups get together and we just talk, and realized we really should collaborate. We do a lot of pessaries, and we obviously share the same goals, similar goals in patients. And so the idea came about that we would love to work with AUGS. SUNA was looking for avenues to collaborate. And again, since this was something that was important and needed to help our patients, it was a great opportunity to collaborate. And we were fortunate that everybody at AUGS was super excited about us doing this with them. And it took a couple of years to kind of get it off and running. But once we did, we really created, I think, a good document that clinicians can get a lot of value with.
I definitely agree. Absolutely. Dr. Clemmons, what can you tell us what the purpose of, why was this document needed?
Well, it was a little bit, honestly, not 100% goal directed at first. Yes, as Amy said, we eventually came upon the idea of like fittings and management and dealing with complications, but it was more open-ended at first. And so basically it was just trying to come up with expert recommendations regarding pessary use. I think it was sort of initially open-ended. And then as we sort of just, we met as a meeting group, and it was probably different from how AUGS might normally do things because SUNA approached AUGS about it. AUGS sent out their applications and to join. And then essentially we formed a group of, I think it had 4 members from each, as I recall. Anyway, point is, so it was a collaborative effort. And as we began to sort of discuss like, hey, what do we want to investigate and look into? We realized that the total science on outcomes was emerging, but not really great. And there was really almost no science at all on sort of pessary care management, how to return, what do you do if this happens or that happens as a sort of a side effect. So we decided that instead of trying to do essentially like a systematic review or meta-analysis of sort of limited emerging data, of which there is better. There's actually some articles on that now, so that does exist. But we decided to really approach it from the point of view is let's form a consensus care guideline document using the Delphi criteria, and really trying to come up with guidelines, especially for sort of like younger practitioners who really don't know what to do when they have to troubleshoot issues with pessary care. That's a long-winded way of saying it, but we just kind of wanted to approach the basic care of pessaries.
Yeah, no, that definitely covered it. Thank you. Dr. Hull, who do you see as the target audience for this document?
Yes, well, Dr. Clemmons definitely mentioned younger practitioners, younger physicians who perhaps are starting their practice, whether that's in urogyn or even in the setting of urology. So there's definitely room for a lot of education. As Dr. Clemmons mentioned, there's just not a lot of information out there to really guide the clinician on what is the best way to manage pessaries. And so we definitely feel like this can be for just a really good sort of groundwork for laying the groundwork to help guide younger clinicians, but also people who've been doing pessaries for a while. I feel like I'm a dinosaur now. I can't imagine how many thousands of pessaries I've managed and placed. But anyway, I learned a lot as I worked with the group. And so there's definitely room for the seasoned professional to gain a lot from this document as well. Whether we're subspecialized or not subspecialized, there's still a lot of general OB-GYNs out there who are managing pessary patients. And I think this could be a good document for them to utilize as well.
Yeah, absolutely. Thank you. Dr. Clemmons, you started to allude to this, I think before, maybe you can flesh it out a bit, but how did you and the group decide what the most important points were?
Well, yeah, I did kind of maybe jump the gun on mentioning that, but yeah, we decided that we really wanted to approach, well, how did we decide? Logistically, we essentially met as a group, had several phone calls, and we sort of just tossed out ideas of what we wanted to investigate. And we came up with all these different concepts and questions related to pessary care and what happens when you run into this problem or run into that problem. And so we just started making a list of ideas and topics, and we came up with all these topic statements, and we just kind of refined it. And it's fascinating because we started with really very little guidance, but just gradually kind of came into this idea that we really want to focus on the topics that essentially would probably never get studied in outcome data, or might almost, they seem less likely because they're not as sexy, if you want to think of it that way. They're just on basic care and management. And so we just wrote up all these topic statements that, like, well, what do you do about this? And what do you do about that? And, we crossed some of them off the list and kept some of them, redefined some of the others. But yeah, it was really just wanting to figure out how often should you replace the pessary? What do you do if there's bleeding? Just really simple ideas and notions. But I agree with Amy, like all of us learn concepts just from others, because you get in your own silo. This is how I do pessary care. And you just start talking and you hear other people's way of doing it. Like, oh, I hadn't thought of that. And so it was eye-opening just for the 8 of us. But I think people who read this document will be like, oh yeah, these are just really simple notions. They're kind of like, you might say, well, duh, this is what you're supposed to do. But you realize there's a lot of ways to approach how to manage pessary care. And I don't know.
Yeah. Well,
I'd like to see what Amy thinks about that same idea, though, because what did you think, Amy?
Oh gosh, that's so true. I recognizing how much variation in practice there is, and realizing that it's sort of like the Wild West. People do whatever, and if it works for them, that's what they were doing, and that's what they document, and that's what I saw in the literature. Just so much variation in practice. And so my hope is that this can be, as I mentioned earlier, some groundwork, laying some foundation so that we can begin to develop standardization of care for patients who use pessaries. There's a lot of work that obviously needs to be done to get to that point, but I think it's definitely of value. I know you mentioned, Jeff, it may not be as sexy, but it certainly is something that's such a common practice and such a common tool that we use for our patients. And if we can create and define and develop protocols to keep our patients safe, healthy, and able to use pessaries in a very controlled way that also gives them freedom, then certainly that's a good thing.
Yeah. Dr. Hall, so just tell us, the viewers, what do you think the 1 or 2 key takeaways are from this document?
So for me, one of the things that I felt like is really important, and we discussed this in our discussion section, and I know that Jeff, you'll probably be discussing this here in a minute too, but there's a lot of need for a lot of work that needs to happen for pessaries and management and understanding what best practices are for our patients. There's a lot of research that needs to be done. There's a lot of opportunity. The other takeaway is this is a good tool for management. This is a good option for patients. And I would really like for clinicians, not just in our specialty, but for clinicians in primary care, in general OBGYN settings, to know more about pessaries and know that that's an option for their patients, and know where they can send their patients to get good care and good management for this treatment option. Those were the things that I felt like, from my own personal perspective, those were the things that I took that were important. And then the realization, the understanding that there's still so much opportunity that can happen.
Yeah. Well, thank you. And I guess I would just ask, lastly, Dr. Clemmons, to if you want to expand on that a little bit, and what you think might be the most important gaps that you identified as important areas for future research.
Yeah, I would say a lot of it has to do with management of complications. I mean, we ran into an interesting situation of even just trying to define what types of complications were in. And that was one of the more interesting discussions we had, is like, well, what's an abrasion? What's an erosion? What do you do when it gets to be this level or that level of an erosion or abrasion or bleeding? And so I think, at least from the point of view of the concepts that we looked at, research on management of these complications, really, this just was our consensus opinion, pretty much. There's really no data on it. And so, and like, we had come up with ideas like, well, should you get up the estrogen, and how long should you give estrogen? When do you do a pessary holiday? All these little notions of how to manage pessaries. And again, everyone's doing it in their own way. And like Amy said, it's like the wild, wild west. So research that really kind of focuses in on some of these questions and addresses some of these concepts, I think would be helpful. To sort of tie it back into what we did in our document, I think we gave a good set of guidelines on how to practice. And I think we gave a reasonable range of how to practice. So no one's tied into doing like, oh, you must do it within 3 weeks or 6 months or whatever. Like, there's a range of how you can practice. And I think the range that we gave for each of these concepts is reasonable. And it's not going to, I don't know how to say this, but we didn't want to write a document that was going to put anyone in any sort of legal trouble if they didn't follow it. And but where can we have important research would be to say, oh, well, we can sort of fine tune these recommendations because now we have data behind it. So really, it's based completely on our consensus opinion, and it'd be nicer if there was more data on how to manage these sort of side effects and complications of pessary care.
Yeah, and look, these are all, as you both said, these are practical things that we deal with every day. And you had consensus from a large group of really qualified people. And so I want to thank you and your writing group for making a great contribution with this document. And I would encourage everyone in AUGS and SUNA in those communities to read this document. I think it would be very helpful. So thank you.
Thanks.
Thank you.